I want to talk about the difference between insulin resistance and diabetes. A lot of people, whenever I make content about insulin resistance, they automatically assume that I'm talking about diabetes, and that is not the case. So, insulin resistance is a precursor to diabetes. I would say if we're thinking about root causes of problems nowadays, migraines, PCOS, all of that, insulin resistance is that root cause problem. Diabetes is the result of the root cause, right? It's what happens down the line. So how does insulin resistance happen, right? So there are two main things that happen with insulin resistance. One, you have something called hyperinsulinemia, which means that your insulin levels are high. Why are they high? Because you've been eating high amounts of carbohydrates, foods, over a long period of time, frequently. Okay, so let's say, for example, in a day, you eat breakfast and then you get a Starbucks with sugar in it. That's another meal. So you get 2 spikes of insulin. Then you get lunch. Then you get a snack. Then you get dinner. Then you get a snack. So you've had 6 insulin spikes in one day. So if you have many insulin spikes in one day, over a long period of time, you will develop insulin resistance. Insulin resistance does not show up in the blood in terms of like high glucose. So whenever people are talking about diabetes, they're thinking, oh, your glucose levels are high. The only reason why your glucose levels become high is if your pancreas produces so much insulin, like your insulin hyperinsulinemia is so high that it just stops working, right? And so then now the insulin doesn't have the capability to get rid of the glucose that's coming into your body as you eat every single day. And that is when we're headed for prediabetes or diabetes, okay? So that happens later on down the line. You can have insulin resistance from age 5. Heck, you can have insulin resistance from age 3 all the way to age 20, 30, 40. And then at that point, you can then develop diabetes, or you develop something else like Alzheimer's, or you develop migraines, or you develop acne, or you develop hypertension, or you develop PCOS, or you develop erectile dysfunction. These are all diseases that stem from insulin resistance. And so whenever you see someone talk about insulin resistance, just know that they're not talking about diabetes. And when you're going to do your blood work, we're not looking at your glucose to see if you're insulin resistant. We're looking at your insulin levels. So you want to make sure that a fasting insulin is checked. Your doctor is probably not going to want to check it because insurance doesn't want you to check it, but that's another story. I do check it in my office, so if you're in the DMV area, then you can come in and I can help you figure out the diagnosis for insulin resistance. But it's important to understand that diabetes is a disease of insulin resistance, but it's just the downline effect, if that makes sense. So if you start to see glucose in your blood, then you've gone past the point of then you've gone to the point of diabetes, right? But if you just have insulin resistance, then your blood is usually going to be normal. So you won't have high sugars. I hope that makes sense.